always a little bit a dilemma what to present when I get invited for a presentation. So usually I end up presenting a lot of stuff from a broad perspective. So this is also the case for today. That we were discussing several ideas and issues with Anna and Agnieszka. And at the end of the day, I will try to give quite a broad overview on fertility in low fertility countries, with some hopefully stimulating or maybe slightly provocative thoughts at the end. So here we see some of the long-term trends and issues which are not a big surprise for you, but I would like to focus my argument a little bit on changes and trends in the last 10 years, where arguably we see some new pressures which are affecting people's fertility decisions, and our research still doesn't really capture these things quite well. So we don't really understand all the shifts and changes in how people decide about having or not having kids, how their fertility plans often remain unrealized. And my big argument is that the coronavirus crisis is likely to accelerate further the shift to postponed fertility and fewer children. If you look at what happened in the last 10 years, the demographers had some difficulties at times explaining some of the fertility falls in a number of countries, which continued surprisingly after the end of financial crises in the period since 2012, 2013 until last year. And sometimes they continued in periods without any obvious economic issues. Years like 2014 to 2019 were in many countries a period of declining unemployment, relatively stable conditions for having kids, no major cuts in family-related policies. Yet, especially countries which were on the higher end of the fertility scale, of the fertility ranking, and especially countries which had this kind of, where demographers were having this kind of notion that these are ideal countries, like almost a paradise for combining kids and careers, also for gender equality. These were the countries which often saw significant fertility declines during the last decade, as you can see also from some of these titles. This is Norwegian Prime Minister in 2019 who expressed worry about low birth rates and asked Norwegians to make more babies. I mean, that's, if you would tell demographers 10 years ago, Norwegian Prime Minister would be asking women and men and couples that they should have more babies for the sake of Norway. It would be difficult to believe this. There are also all kinds of new tensions, concerns, and uncertainties which go beyond the economic uncertainty. And Daniele, who is now listening here or who is participating, he's exploring this concept as well. But I would have even broader perspective. There are also all kinds of worries about inequalities, climate change, political polarization, which may make it difficult for some people to decide to have a kid and to start a family. So this is briefly an agenda of things I will try to squeeze in my next 30 minutes presentation. Give you first some more overview about the fertility trends during and after, especially after the financial crisis. Then I would like to highlight some of the effects of the ongoing shifts to late pregnancies, late childbearing, and their consequences for fertility, which may be becoming more negative in the future. Then I would like to give you some very, very quick evidence on the likely impact of the coronavirus pandemic on fertility. And then maybe in a few minutes discuss an uncertain future of reproduction. So looking first at fertility trends in the last decade, if we go back to the period of financial crises, that was actually the time when fertility was moving in a predictable direction in most places. We know from past research that when economy goes down, this is a time when many people decide to postpone having kids and when fertility rates tend to decline. And this is exactly what this graph from a paper by Chiara Comoli shows, by birth order and by age, suggesting that especially first births and especially actually across all age groups, except for the oldest ones, were declining sharply with increasing unemployment rate. So unemployment is one of the main indicators which really is closely correlated with fertility rates, and increasing unemployment is typically linked to declining fertility rates and to the postponement, especially of first births. With Daniela and with Anna, we have done some smaller scale regional research on fertility declines during the recession period. And this is a map of declines in total fertility rate in 2008 to 14, predicted on the indicators of labor market and economic uncertainty, such as unemployment rates, based on a model which we applied in this paper. And places which you see in darkest red are the places where fertility decline was associated most clearly or predicted most clearly on deteriorating economic conditions in that period. But then when we zoom towards more recent period, this is where things are getting more interesting. If I cut the story really short, all the rich countries which used to have relatively higher fertility rates experienced significant, sometimes really strong fertility declines between 2008 and 2019. So you see here the levels of period total fertility rates in 2008, and then the corresponding levels 11 years later. And there was not a single country in these higher fertility places, among these higher fertility places, which wouldn't experience at least some fertility decline. France is a kind of exception with this relatively slight decline in total fertility rates, but we have cases like Norway and Finland with really plummeting total fertility rates across the board. But we can contrast this evidence here shown for all the Nordic countries with some countries where fertility rates were actually increasing in that period. And typically these were countries in Central and Eastern Europe, but also, for instance, Germany and Austria experienced some increases in fertility rates in the last decade. And without getting too much in detail into this, I would argue that this was quite a specific combination of really rapid economic growth in some Central Eastern European countries. So economic recovery combined often with policy effects, with the governments rapidly expanding their spending on families and on kids. Quite another story is the story of East Asia, where many countries have experienced further declines to ultra low or extreme low fertility rates in the last decade. And the specific issue in that region is that childbearing remains very tightly linked to marriage in this part of the world. And we often see a concerted increase in non-marriage, rise in childlessness, and of course, corresponding declines in fertility in that region. This is a graph of total fertility rates for East Asia. And you see Korea really crashing down with its total fertility rates to 0.92 last year. And this year will be by another 10 or 12% lower. So this year, Korea will have fertility rate just somewhat above 0.8. So what explains these trends, which are sometimes surprising to us, to demographers? If we first look at kind of demographic accounting, demographic components of these trends, we know that there was further postponement of childbearing and fertility rates declined especially among younger women, and these declines affected especially first births. One feature of this decline was also a kind of really rapid fall in early childbearing rates, in teenage childbearing, in countries which used to have an issue with having too many teenage births and unplanned pregnancies and births. This includes all Anglo-Saxon countries, including the United States, New Zealand, Ireland, United Kingdom. So the issue of elevated early childbearing, often linked to lower education, disadvantaged social status, and a lot of unplanned pregnancies, this seems to be largely becoming a matter of the past in countries which used to have elevated teenage fertility rates. We also know that increasing shares of younger people are living in non-family arrangements or with their parents. This pertains even to countries where it's easy to get housing at young ages, like for Finland. So even in Finland, we see that increasing shares of men and women aged 28 are living with parents, are living single, are living in shared accommodation with their peers and other students in dormitories and flats, and in other non-family arrangements. That means without a partner or without a family of their own, with their kids or without their kids. We also know from some surveys, and this is an example from the United States, that there seems to be some decline in fertility intentions in the last decade. So fewer people seem to be planning to have a family. And this includes rising intentions to remain childless. This is a snapshot from a paper on US childbearing intentions between 2006 and 2017. And Caroline Hartnett with Alison Gemmell found that the share of respondents, both male and female, who said they don't plan to have any kids at all, so they plan to remain childless, went up across all age groups, across all education groups between 2006 and 2017. And the trend was arguably most pronounced at young ages, 15 to 29. When we look at trends by education, we see two patterns across highly developed countries, at least as far as I can say from the data which is available up to now. We can either see concerted decline across all education groups, which is the case of Norway, or we see a more concentrated decline among lower educated women, which is, for instance, the case in Australia. So women and populations with disadvantaged status, including ethnic minorities and lower educated groups, clearly participated strongly in the fertility decline in the last decade, which is in some cases different from the past when they often retained higher fertility rates or when fertility rates were declining among other population groups. One group which clearly experienced a lot of fertility declines in most countries is the group of migrants. This is a snapshot of total fertility rates for migrant women from an article by Marianne Tønnesen. And you can really see in the last decade sharp declines in fertility rates among migrant women in most countries which she surveyed or for which she got data, perhaps with the exception of the United Kingdom. As a result of this, migrant women in many of these countries experienced at the end of the decade similar levels of fertility as non-migrant women. One factor which, in my view, hasn't been explored enough is the impact of housing crises and housing unavailability on fertility decision. Across Europe, across highly developed countries, housing prices were rising rapidly in the last decade for different reasons. And this increase was often sharpest in big cities. This is an example of a paper covering the United States, which looks at the timing of first births as it is correlated with median sales price of housing in the big US metropolitan areas. And you see that for women with different levels of education, the age at first child clearly goes up with the median sales prices of housing. This is just one example. I think the whole issue of housing prices and fertility needs to be studied much more. We have a lot of evidence that many young adults continue feeling financial squeeze during the last decade, despite economic recovery in many countries where they live. This has something to do in some countries with rising education costs and student debt, as well as housing prices I already mentioned. Sometimes it has to do a lot with the changing nature of employment and labor market, so issues which many of you know a lot about, irregular and poorly paid jobs, continuing lower levels of wages among those who are employed at younger ages, and in general, falling economic position of younger generations compared to the middle and older generations, which is illustrated here on this picture, which relates the median household income at age 20 to 39 to the total median household income of the whole population. And actually, the picture is a snapshot of changes between 2008 and 2018. And in any places where you see yellow or kind of orange, red, pink colors, these are all the places where relative income of younger generations declined in that period compared to the middle and older generations. This is actually almost all Europe, except for some Central Eastern European countries and except for the Netherlands. I mentioned already the effect of fertility policies, which were driving fertility rates upwards to some extent in some Central Eastern European countries. But here comes a warning. While period total fertility rates sometimes jump very quickly upwards, they can equally quickly crash downwards, like in this case of Russia in the last 3 years. And this is partly because policy changes as well as economic ups and downs often affect more the timing of fertility than the underlying levels of fertility rates, which we would see later on in cohort fertility indicators. So when you try to adjust period fertility indicators for tempo effects and parity composition of the population, the changes in fertility rates often look much less impressive than when looking at the period TFR, as illustrated here in the case of Russia. Which brings me to the last factor of recent fertility declines, which is once again tempo effect. So some parts of these declines, especially in the Nordic countries, but also elsewhere, were driven by the fact that the postponement of family formation has been accelerating during the last decade in many countries. So people are waiting longer before they start having their first child. This brings me to the next topic of, are many of us going to hit the age limits of reproduction? And what does it mean for fertility rates? So there are two technological changes which are kind of driving the shift to late reproduction. One of them, which allows us to postpone childbearing ever more, which is very efficient, availability of very efficient contraception, which means that many of us are effectively able to prevent pregnancies for 10, 20, or 30 years of enjoying partner life or sexual relations. On the other hand, we have advances in assisted reproduction, which obviously allows many women to have babies at very advanced reproductive ages. In between, there are many social, cultural, economic factors which are kind of pushing people to decide to have kids at increasingly later ages. And these factors, which I will not discuss here, are not going away. They range from increasing education through labor market uncertainty up to changes in preferences about children and about family life. Now, if you look at trends in the share of women who remain childless at later childbearing ages, this is one way how you can illustrate this increasing share of women. And the picture would be the same for men if we would have good data for them, even more pronounced, who are hitting ages 35, we can do the same for 40, and who are remaining childless. This wouldn't be an issue if childlessness would be their desired family status at the end of the day, but we know from the surveys of fertility intentions that especially among childless women, but also among many women with one child, more and more of those age 35, 39, and even more and more of those age 40 plus are stating they plan to have a kid in the future. So also planning to have children is increasingly shifting for many women and men towards their late 30s and early 40s. And this picture shows also for Poland, so for 4 selected European countries, that the share of women who plan to have a first child at late or very late reproductive ages is clearly the highest everywhere among the childless ones. This is based on the GGP surveys. And then when we look at the evidence, who actually is getting the kids after the age of 40, we have again the evidence that the likelihood of having a birth after the age of 40, conditional on the number of kids women have at age 40, is going sharply upwards in many countries for the childless women and for women with parity one, with one child. And this clearly contrasts with the way how late fertility was looking in the past, where it was especially those with 2 or 3 kids who were getting another kid after the age of, at late childbearing ages, kind of finishing their family enlargement as long as they could, if they wanted to have another child. Nowadays, the face of late fertility is increasingly turning, or the picture of late fertility is increasingly turning towards more and more women having their first or second child. And we clearly see a shift, quite a big jump, although from very small initial levels, in the share of women having a kid at the age of 40 plus. Southern European countries are farthest in this process, with Spain, for instance, recording 7% of fertility rates among women aged 40 plus. Italy would be very similar in this, but other countries are not far away from this. Now, this is why this might be a problematic thing. If you look at the estimate of how many women are unable to conceive a child after the age of 40, the line gets first gradually upward and then shoots up after the age of 42. The same goes for assisted reproduction with own fresh eggs of a woman participating in assisted reproduction. The success rates of assisted reproduction with fresh eggs crash around the age of 40 to 44 and go down to 0. So even assisted reproduction is not a remedy, it's not a kind of golden arrow which will allow women and couples to have kids anytime they want, unless they go for donor eggs or unless they freeze their eggs at younger ages. The fact that many women are not getting the kids they want at later ages is also seen from different surveys which look at fertility realization of short-term fertility intentions, 3 or 4 years fertility intentions, where the rates of realizing fertility intentions clearly go down among women after age 35 quite sharply. This is a case of a paper I did with Eva Bujan and some other colleagues on Australia. Now we know from other sources, from other data sources, that more and more kids are actually being born after assisted reproduction. And if you look at late or very late childbearing, you can see that a big share of kids among women age 40 plus is born after assisted reproduction. But after the age of 43, most of that is because of donor eggs. So eggs received from another woman rather than own eggs of the woman who participates in assisted reproduction, because these efforts would most likely not be successful at that age. So I would like to argue that although at present late childbearing pattern is not yet associated with lower fertility rates, it will be one of the critical future trends because of a combination of the ongoing factors which are likely to push ever more women who are childless or with one child to stay childless or with one child until mid-30s, late 30s. And this will clearly sustain a rising desire to have a child at late and very late reproductive ages, 40 plus. And obviously infertility, limited success rates of assisted reproduction, miscarriages, and other pregnancy complications imply that most women who are planning to have a child at ages 42 or later are unlikely to succeed at the end of the day. And this is likely to have increasingly negative impact on future fertility rate. Of course, technology can partly change this picture. So development, future advances in health, in egg freezing, and its wider availability may partly improve pregnancy chances, especially among couples who can afford freezing their eggs and waiting some years for using this technology later on. And this may in turn, however, contribute to a spread of childbearing at extreme late reproductive ages. Now we see that numbers of births are rising relatively fastest at extreme ages like 45 plus or 50 plus. These are very small numbers at present. For instance, in Europe, we have about 2,000 births among women aged 50 plus per year. But these numbers, these small numbers, are rising rapidly. Now, before I finish, let me give you some thoughts on the impact of coronavirus on fertility. In the early stage of the coronavirus pandemic, there was even some popular discussion that there might be a COVID baby boom because couples suddenly have more time to spend at home and enjoy their intimacy and so on. But of course, we demographers knew that this is not supported by past evidence on the effects on all kinds of short-term shocks, power outages, natural events, but we also know that all massive economic and non-economic uncertainty which comes up with the COVID pandemic is something which is not really making couples happily planning their next birth very quickly. Clearly, this implies a lot of stress, a lot of struggles for many couples. Some couples were being separated or had less opportunities for dating or moving to live together. So this all points out to something else, that we are likely to experience a massive baby bust since late 2020 and early 2021. And these speculations are first clearly supported by surveys of fertility plans and intentions. This is an example of an early survey from early May in the US, where 1/3, 34% of women reported they wanted to delay childbearing or have fewer children as a result of the coronavirus pandemic. Even more fascinating were findings from a survey in 5 countries in Europe of younger people aged 18 to 34, where among those who said they were planning to have a child in 2020, around 3/4 stated in late March or early April, so that was really the early stage of the COVID pandemic outbreak, that they were planning to postpone these plans or even abandon these plans. And the results were similar across countries. That's quite remarkable. Now, moving from plans to actual fertility rates, for some time we didn't see the actual effects of COVID on fertility rates, because obviously it takes some months to get pregnant, and then pregnancy takes 8 to 9 months on average. But US researchers were looking at Google, trying to correlate trends in different Google searches with birth rates and making a prediction of how US fertility rate may move based on observed Google searches for many different things, economic uncertainty up to searching for favorite pregnancy tests in the US. And these are some of the predictions which they come up with in their model. essentially suggesting that fertility would start declining in November 2020, and this decline in the numbers of births will continue accelerating until February 2021 when they stop the model. So we don't know what would the model do after February this year, which is actually now. Now we already have the first evidence of these things. And if you look at these newspaper headlines, one of them is about Poland, you can already guess that these expectations are now turning a reality. We have first evidence on trends in monthly numbers of births at the end of the last year. And indeed, as we expected, in November or December, especially in December, trends in countries where we have the data, preliminary data mostly, are going downwards. Hungary had positive surplus of births all last year compared to 2019. These are the pink bars you can see here, are all positive. But then in December, things crashed. In France, there was negative trend in most of the year, but this accelerated in November, December. In Korea, as is typical in Korea in the last 10 years, births were going down month by month by month, but this decline clearly accelerated in October and November. And more of these data are likely to come in the next months. And we are trying to build a database of short-term indicators of the numbers of births by months, which will be available in human fertility database within a couple of weeks. So you will be able to pick these data and trends. Now, thinking into a longer-term future, some people are arguing there might be a recovery in fertility rates, in birth rates, once the lockdowns are easing out. But I would argue that we are probably going to face another economic recession in the next year or two. And as we know, economic recessions are not the time when people want to catch up on postponed childbearing. So I have a more kind of negative view about fertility recovery and recuperation. I think that all kinds of factors, economic uncertainty, budget cuts, continuing pandemic, continuing consequences of all the disrupted dating and social contacts in the last year are likely to push fertility rates in many countries to record low levels in the future. And this maybe allow me to speculate for 1 or 2 more minutes about the things which we haven't explored well and which we don't know much about. One of them is that we don't do a lot of surveys of fertility intentions yet, which would be comparative across countries and over time. And in East Asia, we don't have enough data on marriage intentions, but those we have suggest that now we have a new generation of men and women who suddenly don't view the marriage very positively, who don't intend to marry or are uncertain about their plans. There's a lot of uncertainty, and Daniela and his colleagues talk about imagined futures, shared narratives about our future, which can make us very uncertain about deciding about having families and births. But there are new factors, new worries, including climate change, and all kinds of pressures people perceive about how to be perfect parents. What should they do to bring their kids fine so that they will survive in difficult world in the future? And Anna Rothkirch, in a recent paper in Vienna Yearbook of Population Research, has very nice discussion about all these pressures and uncertainties, partly from a psychological perspective. She says that for a digital generation, it's not such a cool thing to have kids. And actually, many people associate child-free lifestyle nowadays with quite positive things. More sleep, more sex, better career. Who wouldn't like to have these things? So to wrap this up all together, I think there are a lot of things we need to study more. And there is a lot of stuff we are going to research in the next years, hopefully, to understand fertility trends better than we do at present. I would like to recommend you to have a look at this last issue of the Vienna Yearbook, not because I edited it, but because there is a very nice discussion debate about the factors which may affect the future of fertility rates. And I would like to thank you very much for your attention.